Hey everyone, Dr. Helal here and welcome back to the channel. Today we're discussing a topic that's very common and can be pretty uncomfortable: urinary tract infection, or UTI for short. Now, UTIs are those infections that can occur anywhere along your urinary tract: kidneys, bladder, and urethra. Millions of people dealing with these every year, and trust me, nobody wants to experience the burning, the urgency, the other symptoms. So, in this video, we discuss the causes of these UTIs and the signs and symptoms that you must not ignore. Let's get to it. Before we continue, please subscribe to the channel now. Also like and share the video. Poor hygiene is a common cause of UTIs. Bacteria thrive in warm, moist environments. The area around the urethra is a prime spot. Wipe front to back to prevent bacteria spread. This habit helps prevent UTIs. Good hygiene is important for everyone's health. Let's talk about something we're all guilty of: holding in our pee. We've all been there, right? But holding your urine too long can increase your risk of a UTI. Your bladder sends signals to your brain when it's time to pee. Ignoring those signals lets bacteria multiply, increasing infection risk. Listen to your body and pee when you need. Alright, let's talk about a topic that can sometimes feel a little awkward, but it's important to address: sexual activity and UTI. Now, while sex itself doesn't directly cause UTIs, it can increase the risk, especially in women. Here's why. During intercourse, bacteria from the vaginal area can sometimes get pushed into the urethra. And as we've already discussed, the urethra is like a direct pathway to your bladder, where those bacteria can potentially cause an infection. Now, don't let it scare you. There are things you can do to minimize the risk. First and foremost, urinating after sex is a simple yet effective way to flush out any bacteria that might have been introduced during intercourse. Staying well hydrated helps dilute your urine and makes it easier to flush out those bacteria. And of course, communicating with your partner about any concerns is always a good idea. Staying hydrated is important for preventing UTIs. Dehydration means less urine, which can lead to urinary tract issues. Urine helps flush out bacteria and waste. Without enough fluids, urine becomes concentrated and less effective. This can lead to bacteria buildup and UTIs. Aim for at least 8 glasses of water a day. Keep your urinary tract healthy by staying hydrated. About birth control and its potential link to UTIs. Now, it's important to note that most forms of birth control are perfectly safe and effective. However, certain types, like spermicides and diaphragms, can sometimes increase the risk of developing a UTI. Here's why. Spermicides, which are chemicals that prevent pregnancy by killing sperm, can also disrupt the natural balance of bacteria in the vagina. This disruption can make it easier for harmful bacteria to thrive, potentially leading to UTIs. Similarly, diaphragms, which are barrier methods of contraception, can sometimes create an environment in the vagina that's more conducive to bacterial growth, again, increasing the risk of UTIs. If you're using spermicides or diaphragms and experiencing recurrent UTIs, it's worth discussing alternative birth control options with your doctor. They can help you find a method that's both effective and minimizes your risk of infection. Our immune system is our body's defense force, protecting us from harmful invaders like UTI-causing bacteria. When compromised, we are more vulnerable to infections. A healthy immune system is like a strong army, quick to neutralize threats. A weakened system struggles. Infections can take hold. Conditions like diabetes suppress the immune system. Healthy lifestyle boosts immunity, reducing infection risk. Urinary catheters are medical devices that provide a vital lifeline for individuals who have difficulty emptying their bladder naturally. They're used to drain urine from the bladder and can be temporary or long-term, depending on the individual's needs. While catheters are essential for many, they can unfortunately increase the risk of UTIs. This is because the insertion of a catheter can sometimes introduce bacteria into the bladder, where they can multiply and cause an infection. To minimize the risk of catheter-associated UTIs, healthcare professionals follow strict sterile techniques during insertion and while caring for the catheter. This includes thorough hand washing, using sterile equipment, and ensuring the catheter remains clean and unobstructed. If you or a loved one require catheterization, don't hesitate to discuss any concerns or questions about UTI prevention. Drop a comment below. Kidney stones, those hard deposits that can form in the kidneys, aren't just painful. They can also increase your risk of developing UTIs. When a kidney stone blocks urine flow, it creates a stagnant pool where bacteria can thrive. Instead of being flushed out, bacteria multiply, increasing UTI risk. Seek medical attention if you suspect kidney stones. Early detection and treatment can prevent complications, including recurrent UTIs. So, there you have it, guys. Do not forget to subscribe, like and share the video. We've covered some of the most common culprits behind those uncomfortable UTIs, from hygiene habits to underlying medical conditions. Understanding the causes is the first step in prevention. Remember, if you experience any of the symptoms we've discussed, like that persistent urge to pee, burning sensation or cloudy urine, drop a comment below the video. Early diagnosis and treatment are key to preventing those UTIs from escalating into more serious complications. Now, I know we covered a lot today, and I don't want to overwhelm you, but knowledge is power, and when it comes to your health, staying informed is crucial. If you found this video helpful, hit that like button and share it with your friends and family. And be sure to subscribe to the channel for more health tips and advice. Until next time, stay healthy. Again, I'm Dr. Helal from Heal Medical.